If you're turning 65 and coming up on Medicare, today's video is really going to give you some of the learning that I think you need to get started on this whole process. So you really have three decisions that are critical, and you need to get them right, and you need to understand the sequence of these three decisions. So the first one is going to be with Original Medicare Parts A and B, is whether you sign up for them when you turn 65 or whether you delay. And so you say, well, what about a delay? Well, if you're still working and covered under group insurance, you may want to delay your start of Medicare Parts A and Part B till the time you leave your work. Or you may not. If you need the Medicare insurance, or you're not working, or you're paying for insurance on your own, then that's a pretty simple decision. You're going to want to sign up for Medicare, Original Medicare Parts A and B. Okay? So once you make that decision, now we move on is how are you going to receive your Medicare? Are you going to stay on Original Medicare, or are you going to purchase a Medicare Advantage plan, which is really going on Part C, and it's getting your insurance, your Medicare insurance, from a private insurance company instead of directly from the government. So that's one route to go, is the Medicare Advantage route. The other route is to keep your Original Medicare, still get your Medicare insurance directly from the government, and purchase a supplement to Medicare. And this is a completely different route. So you're going to get your Medicare from the government. You got fairly large deductibles and co-payments, or you've got liability, and what you're going to do is you're going to stay on that, and then you're going to purchase a supplemental plan which is going to pay all those liabilities for you, or most of them, so that you have very little out of pocket. So these are two very distinct routes, is you're going to have this plus this, or you're going to have this turned into this. So that's the second decision. And then the third decision is going to be, once you've made those first two, is what insurance company are you going to buy your insurance from? So if you're over here on the Medicare Supplement route, we're just showing you prices around the country for 6 of these companies, but it's the same companies that offer Medicare Supplement, offer the Medicare Advantage plans, and we're going to be into that, as well as the standalone Part B, Part D drug plans. So those are the three decisions that we need to make, and what I'm going to do today is get into each one of those decisions a little bit and tell you what's going on so that you can really make them from an educated place. So Original Medicare is broken into two parts. It's Part A, which is your hospital bill and your hospital coverage, and Part A does not cost you anything once you're on it. Okay, you've been paying taxes your whole life for this, and now when you're on Medicare, you just sign up for Part A and you're entitled to it. Part B is a little bit different. It is your doctor and outpatient. It's the part of Medicare that pays 80% of your bill, and then that's leaving you with 20% of the bill, which is going to come out of your pocket. And that's why people buy Medicare supplements if they stay on Original Medicare. So you got Part A and Part B, and Part B costs $148.50 a month, and most people have this deducted from their Social Security check if they're on Social Security already. If you're not on Social Security yet, you're going to have to pay this bill into Medicare, $148.50, and if you're a high-income person, you've got this thing called IRMA, which is an additional, it's like a surcharge, and it can make this, up to triple or higher than triple, it's quadruple this amount when you put the two together. I mean, it's just, for high-income people, if you want to learn about IRMA, just give me a call, get in touch with me, I can walk you all through it. And with Part B, you've got these lifetime penalties for making a late sign-up where you didn't do this properly. So you really, if you're a working person, now working and covered under group insurance, and you've decided to delay, make that decision cautiously, because if you later get onto Part B and you didn't do things properly, you're going to have to pay a penalty, and you might not be able to get on it as quickly as you want. So That's the first decision, is whether we're going to start this at turning 65 or we're going to start it at some later date. Okay? So then when we move into the second decision is really whether or not you're going to take this and turn it into this, which is a Medicare Advantage, okay? Or you're going to stay on original Medicare and you're going to add to it a Medicare Supplement, okay? And all of that is outlined here. Now, if I'm going to help you with the decision, so why would you want to do one or the other? Because this is just clearly a one or the other thing that you need to make before you start digging into which company. So the advantages or the pluses of Medicare Advantage are a few. Number one is many of these come at zero premium. So if you're able to get on Medicare A and B and then outsource your Medicare to a company like Humana or United Healthcare, AARP, that type of company, most likely you're not going to have to pay any premium. It's a zero premium. And some of them will also give you some money back toward this Part B premium that you got to make. So you get a credit back for that. So the advantages to this is it generally costs less out of your pocket while you're healthy on the Medicare Advantage. You also get some of these extras, like you get included a Part D drug plan, just comes with the package. You have dental, you have vision. Some of these offer gym memberships. They offer food plans. There's a lot of extras that come with these, okay? That's the pluses. The disadvantages to these Medicare Advantage plans is, number one, you have a network of doctors and hospitals. So generally you need to go to the doctors and the hospitals that are on the plan and covered under the network. Now most people are used to networks if they've been on group insurance under 65, so this is not real troubling. But it is a disadvantage to these plans that you're going to have to play by their rules. And you also have deductibles and co-payments on these plans. Not as high as you have on original Medicare. They're much smaller, but they still add up over time. Now, the other route, or the other piece of this decision, is you're going the Medicare Supplement route. And that's where you have original Medicare, and then you're adding to it a Medicare Supplement. And the Medicare Supplement is going to pay this 20% that's not covered under Part B. That's what it's for. It'll even pay excess charges. And it also, when you're turning 65, you've got an open enrollment onto these Medicare Supplements, meaning that you have to answer no health questions at all. We have people that are on kidney dialysis, or people that have cancer, people with diabetes, people with very serious chronic illnesses, where under normal circumstances they wouldn't be able to even get a Medicare Supplement. They're guaranteed that they can pick any company they want within 6 months of when they go on Medicare. It's called open enrollment. So there would be a reason to go this route if you've got a serious chronic illness, or at least to consider going this route, is you can buy these policies without answering any health questions. And then, what we're featured here and what most of our customers buy is the Plan G. And the Plan G is it's just A, B, C, D, blah, 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 has the most benefits that are available to people turning 65 now. And what we've shown here is the pricing across the country. And we're started out in New York, which, we're in all 50 states in the District of Columbia. We're licensed there and we can take care of people anywhere in the United States. New York is the most expensive to buy a Plan G. And you can look at the difference in pricing here is that AARP is going to charge you $268 a month for a Plan G, 65 years old in New York, and Mutual of Omaha is going to charge you almost double that for exactly the same thing. All of these prices here, regardless of which company they're with, are for exactly the same thing. So why would you what are the advantages of going original Medicare and a Medicare Supplement? So the advantage number one is you can go to any doctor in the United States and hospital that accepts Medicare. I mean, that's huge for a lot of folks, is you're not going to have to mess with a network. So that could well be the biggest advantage. The second advantage of these is they take care of most And the Plan G covers most of your deductibles and copayments. In fact, when I say most, there's going to be a $230 Part B deductible in 2021. And that's going to be your only liability for stuff covered under Medicare between original Medicare and a supplement. So there's a real clear advantage is this is going to pay better when you're sick, and it's going to let you go to any doctor and hospital that takes Medicare. And the disadvantage is you got to pay this premium every month as opposed to the zero premium. So, you know, and that may depend on which state you're in. If you're over in North Carolina, which is where our business is located, and I live, this is one of the lowest priced states in the country. And you can see that there's some variance in cost. And we're just showing these 6 companies. There's actually about 40 different companies in any given state that offer the Medicare supplement coverage, and they're all selling exactly the same thing. So price is a big factor. And we're able to spreadsheet these things and let you decide. Now, another advantage, and then you could call it a disadvantage, of going the original Medicare plus a Medicare supplement is you also need to purchase a Part D drug plan. So the disadvantage is you got to pay the premium for that, 10 to 40 bucks a month. Some of these have actually come down in premium over time. But what the advantage to that is we can actually plug in the drugs you're on, and we can get you with the one that's going to pay the best on your drugs. So whereas you're over here, you're not going to have to pay for your Part D drug plan. It's just going to come as part of the plan. But what the disadvantage to that is you're just going to get whatever's tacked onto the plan that you want. Here you're going to have choice. Okay, so then the third decision that you're going to make is once you've decided whether you're going to go here or you're going to go here and here and here, is what company are you going to buy it from? And you know, we can offer you more choices than these 6, but these are names that you're going to recognize most likely, and many of the other companies you've not heard of them before, but they're perfectly fine options. We can go over that when you call us and show you different options. But I've chosen these 6 because they're the largest. They're also, with the exception of Mutual of Omaha, they're the main companies that offer the Medicare Advantage plans. So when you come over here, you can look at an Aetna Medicare Advantage, you can look at a United Healthcare AARP, you can look at Humana, you can look at WellCare, and then when you're over here, you can look at these ones plus a bunch more, and they're the same companies that offer the drug plans. And then we as well offer standalone dental and vision. So, and you have to pay for that separately if you buy a separate policy for it. You're going to get some coverage for that over here at a zero premium under the Medicare Advantage plan. So we're pretty neutral as whether which route you're going to want to go. And we become less neutral once we get to know you and find out what your preferences are, what your budget is for this sort of thing. So we provide consulting on it. Now I want to talk about a couple more things before we sign off. One is a question that we get asked many times is that a lot of folks think that Social Security starts when they turn 65. And it used to work that way. And it can actually start now earlier than 65. But we have this thing with Social Security called full retirement age, or FRA. And the same people that do Medicare do Social Security, or the same Social Security does Medicare. So when you're talking to them, you're going to need to talk to them about when you're going to start your Social Security. And full retirement age is on its way to 67. So, you know, at my age, I'm 62. My full retirement age, I was born in 1958, is 66 and 8 months. People just a little bit younger than me, it's going to be 67. And for you, if you were born in 1956, your full retirement age is 66 and 4 months. If you're 1957, it's 66 and 6 months. And what full retirement age means is that's when you're going to get your full benefit of Social Security. Now, you still may not want to start on that date. You may want to delay all the way to 70 because you'll get a larger check, but you're also going to miss out on those checks. Some of you may already be on Social Security because you started early. then this whole explanation is kind of a moot point. There's also factors with Social Security about your spouse, is that many of you will collect on your spouse, who is the higher earner, if that's the situation. If you have a deceased spouse and you didn't remarry before 60, you can collect off of their benefit. Divorced spouse, the same thing, different benefit. So there's a lot of consulting that can be done on that. And what I'll add on this video is age 64 is a great time to be looking at your IRA and 401k and seeing, now I'm going to need to turn that into an income in retirement. How do I do that? We can certainly help you with that. Life insurance, it's a point where life insurance is still affordable, and if you've been relying on group insurance or you have term insurance that's expiring, we can get you a smallish policy or smaller policy or even a large policy that's going to be in force for the rest of your life. And then we need to have the discussion about long-term care insurance and who's going to take care of you when you can't take care of yourself, if that situation happens to you. So I'm Hans Scheil, and I thank you very much for listening.